Your heart can send out silent SOS signals long before a heart attack strikes, but most people ignore them. Doctors say there are 6 hidden signs that quietly reveal your heart is struggling, and they have nothing to do with chest pain. From unexplained fatigue to swollen feet, strange coughs, and even jaw pain, your body is warning you, but are you listening? These signs are often dismissed as age, stress, or just being tired, but missing them can be deadly. Once you spot even one of these symptoms, it's not just a health tip, it's a life-saving wake-up call. Your heart speaks, but only the wise pay attention. Fatigue is one of the most common symptoms people brush off. We blame it on work, stress, age, or lack of sleep. But what if that constant tiredness isn't just tiredness? What if it's your heart silently crying for help? Doctors say one of the earliest and most dangerous signs of heart failure is unexplained fatigue, the kind that doesn't go away even after rest. This isn't normal tiredness. This is your body saying, something is wrong. When your heart weakens, it can't pump enough oxygen-rich blood to your muscles and organs. So the body goes into survival mode and steals energy from everything else just to keep you alive. That's why even simple things like climbing stairs, walking a few steps, or doing routine tasks suddenly feel exhausting. You may feel sleepy during the day, drained after small activities, or wake up tired even after a full night's sleep. That's not laziness. That's a heart in distress. And here's the dangerous part. Most people don't recognize this symptom. They drink more coffee, sleep more, or think they're just getting older. Meanwhile, the heart keeps weakening, quietly, slowly, and fatally. Doctors warn, if you feel tired for no clear reason, especially with no change in your lifestyle, pay attention. If fatigue is joined by breathlessness, swelling in the legs, or dizziness, it's no longer a small issue. It's a red flag, and you don't wait for chest pain to take it seriously. By the time chest pain arrives, it's already too late. Your body always speaks. The question is, do you listen? Silent fatigue isn't just a mood. It's a message. Sometimes the most dangerous heart attack isn't sudden. It's the one your body tries to warn you about for months. Most people think swollen feet or ankles come from standing too long, eating salty food, or being overweight. But doctors warn that persistent swelling in the feet, legs, or ankles can be one of the clearest hidden signs of heart failure. This swelling, known as edema, isn't just a water problem, it's a heart problem. Here's what's really happening. When the heart gets weak, it can't pump blood efficiently. That means blood starts to pool in the lower parts of the body, especially the feet and legs, thanks to gravity. The pressure builds inside the blood vessels, pushing fluid out into the surrounding tissues, causing puffiness, tight skin, and swelling that gets worse as the day goes on. But wait, it doesn't stop at the feet. That same trapped fluid can move upward, causing bloating in the belly, swelling in the hands, and even sudden weight gain. Many people think they're getting fat, when in reality, their body is filling with fluid because the heart is failing to keep up. Doctors say if your shoes suddenly feel tight, socks leave deep marks, or your legs feel heavy and balloon-like, don't ignore it. Especially if the swelling gets worse at night, or improves a little after sleep. That's a classic pattern of heart-related edema. Here's the scary truth. By the time swelling shows up, the heart has already been struggling for a while. And most people miss this sign because it looks harmless. They take painkillers, massage their feet, reduce salt, but they never check the real cause. A tired, overloaded heart that can't pump hard enough. Even worse, some people think swelling is normal with age. It's not. It's a warning. If swelling comes with shortness of breath, fatigue, or sudden weight gain, that's not something to watch, that's something to act on immediately. Your feet are not the problem. Your heart is sending the signal through them. When the body fills with water, it's not because you're drinking too much, it's often because the heart is failing to move it. Swollen feet don't just need rest. They may need a cardiologist. Listen before the swelling rises. And so does the danger. Most people think a cough means a cold, allergies, or maybe a little chest congestion, but doctors warn that a constant cough, especially at night, can be a silent alarm from a weakening heart. This isn't the kind of cough that comes with fever, sore throat, or mucus. This is a dry, stubborn, unexplained cough that often gets worse when you lie down, and it has everything to do with the heart, not the lungs. Here's the truth most people never hear. When the heart starts failing, it can't pump blood properly. That causes fluid to back up, not just in the legs, but also in the lungs. And when fluid begins to fill the tiny air spaces in the lungs, the body reacts by coughing. Not to clear phlegm, but to fight for air. That's why heart-related cough is often called cardiac cough. It's the body's desperate attempt to breathe when the lungs are slowly drowning in trapped fluid. People with this issue may notice a cough that gets worse while lying flat, a cough that disturbs sleep or forces you to sit upright, wheezing or breathless coughing fits at night, a pink, frothy or blood-tinged mucus in severe cases. But here's the scary part. Most people treat it like a cold. They take syrups, honey, antibiotics, and nothing works. Because the cough isn't coming from the throat, it's coming from the heart. Doctors say this nighttime cough is one of the most overlooked signs of heart failure, especially in older adults. Many shrug it off for months, until breathing becomes so difficult they can't lie down without choking or gasping. By then, the heart is already in crisis mode. Ask yourself, if you're coughing at night but feel fine in the day, if the cough feels deep or dry, if you wake up breathless or need extra pillows to sleep, it's not a flu, it's a warning. Your lungs shouldn't sound like they're struggling. Your sleep shouldn't feel like a fight for air. A cough doesn't always come from the chest. Sometimes it comes from the heart. And when the heart coughs, it's never just a cough. When people imagine heart trouble, they think of crushing chest pain, but what if the heart's danger signal doesn't show up in the chest at all? Doctors warn that jaw, neck, shoulder, or upper back pain can be one of the most silent and surprising signs of a struggling heart, especially in women. This is the warning almost everyone ignores, because it doesn't feel like a heart problem at all. Here's why it happens. The heart and these areas of the body share the same nerve pathways. When the heart is in distress, the brain can misinterpret the pain and send it to other places, a condition known as referred pain. That means what feels like a stiff neck, a sore jaw, or a pulled muscle in the upper back can actually be the early voice of a heart attack in progress. And the danger? Most people don't connect the dots. They take a painkiller, massage the area, or blame it on stress, posture, or age. Meanwhile, the clock is ticking on a silent cardiac event. Doctors say these are the red flags to watch. Pain or tightness that comes and goes, especially with activity. A dull ache spreading from the chest to the jaw or shoulder. Sudden stiffness in the neck or upper back without injury. Pressure-like pain moving up toward the ear or down the arm. Pain that worsens with exertion and eases with rest. Women are especially at risk. They're more likely to feel jaw, back, or neck pain instead of classic chest pain during a heart attack. That's why thousands of women every year die simply because the pain didn't feel like the heart. Your body isn't confused, it's communicating. But if you don't understand the language, you miss the message. A heart attack doesn't always slam into your chest. Sometimes it whispers through your jaw. Sometimes it tightens your neck. Sometimes it aches through your back like a pulled muscle that won't go away. If the pain is strange, sudden, unexplained, don't massage it away, question it. The heart doesn't always scream. Sometimes it gives you one last quiet warning before it stops. Weight gain is usually blamed on overeating, hormones, or lack of exercise, but rapid, unexplained weight gain is one of the most dangerous and overlooked signs of heart failure. Not the kind that happens over months, but the kind that happens in just a few days. Doctors warn, if you gain 2 to 5 pounds in 24 hours, or 6 to 10 pounds within a week, it's not fat, it's fluid, and your heart is the reason. Here's what's really happening inside the body. When the heart becomes weak, it can't pump blood properly. This causes the kidneys to panic and hold on to salt and water. The result: fluid starts collecting in your body, not just in the feet, but in the belly, legs, hands, and even face. You see the number rising on the scale, but you don't feel heavier, you feel bloated, tight, swollen, and uncomfortable. Doctors call this fluid retention, but in reality, it's the body filling up like a water tank because the heart can't keep up. The scariest part: most people have no idea their weight gain is actually heart-related. They think, I'm eating too much, it's age, it's hormones, I need more exercise. Meanwhile, the real problem isn't on the plate, it's in the pump. Signs your weight gain is from fluid, not fat. Check mark: clothes feel tighter, but you didn't overeat. Check mark: rings or shoes suddenly don't fit. Check mark: belly feels hard or stretched, not soft. Check mark: you gain weight overnight or in a few days. Check mark: you feel short of breath or tired while gaining. This kind of weight gain is not a diet problem. It's a circulation emergency. Doctors say that sudden fluid gain is often the earliest warning that the heart is losing its strength, and if ignored, it can lead to a hospital emergency within days. Because when the body retains fluid, it's not just sitting in your legs. It's also building up around your lungs, slowly suffocating you from the inside. Your scale could be the first life-saving alarm you ever get. If you know what it's trying to say. If your weight jumps and you know your habits didn't change, don't blame food. Blame fluid. And check your heart before the heart stops you. Most people only expect to feel out of breath after running, climbing stairs, or doing intense exercise, but when you start struggling to breathe while sitting, lying down, or doing nothing at all, that's not normal tiredness, that's your heart waving a red flag. Doctors call this dyspnea, and when it happens at rest, especially at night, it's often a silent sign that the heart is no longer strong enough to pump blood efficiently. When the pump weakens, blood begins to back up into the lungs, and instead of air, the lungs start filling with fluid. That's why people with early heart failure feel like they can't get a full breath, even when they're not moving. It feels like you need to sit up just to breathe. You gasp for air after lying flat for a few minutes. You wake up at night feeling like you're suffocating. You can't talk long sentences without pausing for breath. You feel air hunger, like oxygen just isn't enough. And here's the scary truth. Most people don't link this to heart failure. They blame asthma, age, anxiety, humidity, or being out of shape. But if breathing becomes difficult without physical effort, it's one of the strongest warning signs the heart is losing its power. Doctors say the most dangerous kind of breathlessness is the one that comes, checkmark, at rest. Checkmark at night. Checkmark while lying flat. Checkmark without any chest pain. This is why many heart patients sleep with extra pillows, sleep sitting up, or suddenly wake up gasping. Not because of a dream, but because their lungs are literally filling with trapped fluid. Breathing should be effortless. If your body suddenly makes you work to breathe, it's because the heart can't keep the lungs clear anymore. This isn't just a symptom. It's a countdown. Once shortness of breath shows up at rest, doctors say the heart is already under serious strain, and ignoring it can lead to a full-blown emergency within days or even hours. Your breath is your life. If your breath changes, your heart is speaking. Most people think dizziness is caused by low sugar, weakness, or standing up too fast. But doctors warn that frequent dizziness, lightheadedness, or fainting spells can be a silent sign that the heart is failing to deliver enough blood to the brain. And when the brain doesn't get the oxygen it needs, it reacts instantly, by making you feel like the world is spinning, tilting, or fading out. Here's the truth most people never consider. Your brain is the first organ to panic when the heart slows down or weakens. If the heart can't pump forcefully enough, the blood pressure drops, and suddenly the brain is running on low fuel. That's when you feel a sudden wave of dizziness, black spots or blurred vision, lightheadedness after standing or walking, a feeling of about to faint, full blackout or collapse in severe cases. And here's the dangerous part. People don't think heart, they think dehydration, weakness, heat, or it'll pass. So they drink water, sit down, or brush it off, while the real problem is quietly cutting off blood flow to the brain. Doctors say this symptom often appears before chest pain, before swelling, before any obvious sign of heart trouble. That's why it's one of the most shocking, and most deadly, early red flags. You're not supposed to feel dizzy for no reason. You're not supposed to lose balance while doing normal tasks. You're definitely not supposed to faint randomly. If the room spins when you stand, if you feel like collapsing after mild movement, if you faint without warning even once, that is not just dizziness. That is a circulation emergency. Heart-related dizziness is especially dangerous because it means the heart is already struggling to keep blood moving to the most important organ in your body, your brain. And remember, a weak heart doesn't only fail slowly, sometimes it shuts down suddenly. Many people ignored small dizzy spells, right up until they collapsed during a heart attack or cardiac arrest. Your body doesn't make you faint for fun. It makes you faint because something is failing inside, and it's running out of ways to warn you. When people notice cold hands or feet, they usually blame the weather, poor circulation, or low iron, but doctors warn that constantly cold, numb, or bluish fingers and toes can be a hidden sign of heart failure or severe heart weakness. This isn't just a blood flow problem. This is a survival mode signal from a heart that can no longer pump enough blood to reach the body's farthest points. Here's what's really happening. When the heart weakens, it prioritizes the vital organs, the brain, lungs, and heart itself. That means less blood goes to the skin, hands, toes, and fingers. The result: fingers and toes turn cold, even in warm weather. Skin around nails or lips appears blue or purple. Hands and feet feel numb, tingly, or dead. You struggle to warm them up, no matter what you do. This is your body screaming. There isn't enough blood to go around. Doctors call this poor peripheral circulation, and while many people blame it on anemia, diabetes, or low temperature, the root cause is often a struggling heart that simply can't push blood to the edges anymore. And the scariest truth, by the time blood flow is so low that the fingers and toes start to change color, the heart is already under heavy stress. This isn't an early warning, it's a late-stage cry for help. Ask yourself, check mark, do your hands or feet turn cold long before anyone else's? Check mark, do your toes or fingertips look pale, bluish, or darker than usual? Check mark, do they stay cold even when the rest of your body feels warm? Check mark, do you feel tingling or pins and needles with no clear reason? If yes, that's not just cold. That's your circulation shutting down from the outside in. The body always saves the center first and sacrifices the edges. Cold hands and feet are not just discomfort. They are proof that the heart is no longer able to keep the blood moving at full force. You don't need to wait for chest pain to know the heart is failing. Sometimes the warning isn't in the chest, it's in the fingertips. If your hands are freezing but the room is warm, your heart may already be running out of strength.